You know how many men over 60 end up in the ER during intimacy? I see cases every single month.
And you know how many Japanese men in their 70s live fully without that fear? The problem isn't age, Michael.
3 months ago, my patient, 67 years old, nearly died. Right during intimacy.
What brought him there? Passion? Or 20 years ignoring his body's signals?
80% blockage in his coronary artery. Now his wife blames herself, and she's terrified to touch him.
That's the real tragedy, isn't it? Fear kills the relationship faster than any disease.
So today we're answering the question nobody wants to ask. Is intimacy after 60 dangerous or necessary?
And more importantly, how do we do it without ending up in your emergency room, Michael?
Let's start with what actually happens to your body. During intimacy, your heart rate jumps to 120 beats per minute.
That's like climbing stairs?
2 flights fast. Your blood pressure spikes. Adrenaline floods your system. For a healthy heart, that's fine.
But you're describing a sprint, Michael. Intimacy should be more like a dance. Rhythm, not rush.
Poetic, but physiology doesn't care about your metaphors. If your arteries are narrow, that spike can trigger a cardiac event.
So we teach people to prepare their bodies, not to avoid the experience entirely.
Exactly. Here's the test. Can you walk briskly for 20 minutes without chest pain or severe shortness of breath?
If yes, then you're likely safe.
If yes, then your cardiovascular system can handle the load. But there are red flags we cannot ignore.
Tell me the danger signs.
Recent heart attack within 6 weeks. Unstable angina. Uncontrolled high blood pressure, over 160/100. Severe heart failure.
In these cases, you must wait and heal first.
Right. But here's what patients don't realize. Most intimacy-related cardiac events happen to people who were already high risk and ignored the signs.
So the act itself isn't the villain. It's the 20 years of neglect that came before.
Precisely. My patient had chest pain for 3 years. He never told anyone. Not his doctor, not his wife.
Pride or fear?
Both. He was terrified of being seen as old or broken. So he stayed silent until his body screamed.
And this is where Western medicine often fails. You treat the emergency, but miss the emotional wound that caused the silence.
Fair point. Now let's talk about the medications, because this gets messy. Blood pressure drugs, especially beta blockers, can reduce performance.
And then men panic and stop taking the medication without telling their doctor.
Which is catastrophic. Stopping beta blockers suddenly can trigger rebound hypertension, or even a heart attack. Never do that.
So what's the solution? Just accept the side effects?
No. Talk to your doctor. There are alternatives. ACE inhibitors or calcium channel blockers often have fewer issues, but you must communicate.
And here's what I disagree with you, Michael. You treat this like a plumbing problem. Adjust the medication, fix the pipe. But it's deeper.
Go ahead. Enlighten me.
In Japan, we see intimacy as a reflection of life force. If a man has no desire, it's not just low testosterone. It's disconnection from purpose.
Hiroshi, I have patients with testosterone levels in the basement. You can't meditate your way out of hypogonadism.
And you can't inject your way into desire, Michael. Testosterone replacement without addressing lifestyle stress and relationship quality is just expensive urine.
Okay, I'll give you that. Testosterone therapy only works if the rest of the system supports it. But let's be clear about something.
What's that?
After 60, testosterone naturally drops. That's not a disease. But if it falls below 300 and you have symptoms, then replacement can be life-changing.
What symptoms matter most?
Fatigue, muscle loss, brain fog, and yes, reduced libido. But here's the catch. You must monitor for prostate issues and cardiovascular risk.
And this is why I push back on quick fixes. You give a man testosterone without teaching him to move, eat well, and manage stress?
Then he's building a house on sand. I get it. So let's talk about your approach. How do Japanese men maintain vitality without medication?
First, they don't retire into a void. Purpose extends lifespan and libido. Many Japanese men work or volunteer into their 70s.
So staying engaged mentally keeps the body engaged physically.
Exactly. Second, they walk. Every day, 30 to 60 minutes. This improves circulation, lowers stress, and maintains cardiovascular fitness.
Which directly supports what I said earlier. If you can walk briskly, you can handle intimacy.
Third, diet. Less processed food, more fish, vegetables, fermented foods. Omega-3s support hormone production and reduce inflammation.
I can't argue with that. Chronic inflammation destroys vascular health and testosterone production. But Hiroshi, here's where I think you're missing something.
What am I missing?
Psychological fear. In America, after 60 men are bombarded with messages, you're old, you're done, your body is failing. This creates anxiety.
And anxiety kills arousal faster than any medication side effect.
Exactly. Performance anxiety creates a vicious cycle. Fear of failure leads to avoidance. Avoidance leads to relationship tension. Tension increases fear.
In Japan, we don't separate the mind from the body. If the mind is agitated, the body cannot respond. This is why meditation and breathing practices matter.
Okay, so let's combine our approaches. If someone over 60 wants to maintain a healthy, intimate life, what's the protocol?
I'll start. First, assess your cardiovascular fitness. Can you walk briskly or climb stairs without symptoms?
If no, see a doctor for cardiac clearance. If yes, you're probably safe, but still get a checkup annually.
Second, manage your medications intelligently. Never stop taking blood pressure or heart medications without medical guidance.
But do talk to your doctor if side effects are affecting your quality of life. There are often alternatives.
Third, build your foundation. Daily movement, healthy, whole foods, stress management. These aren't optional, they're essential.
Fourth, consider testosterone testing if you have symptoms. But only pursue replacement therapy under close medical supervision with regular monitoring.
Fifth, communicate with your partner. Fear, silence, and avoidance destroy intimacy faster than any physical limitation.
And sixth, redefine what intimacy means. It's not just about performance, it's about connection, presence, and pleasure.
Exactly. Slow down, breathe, be present. This isn't a race, Michael. It's a dance, remember?
Fine, I'll accept your dance metaphor. But only if you accept that sometimes dancers need their knees checked before they hit the floor.
Deal. Now tell me what happened to your patient, the one who ended up in the ER. How did his story end?
He survived. After 2 stents and 3 months of cardiac rehab, he's stable now. But here's the interesting part.
What changed for him?
He and his wife went to counseling. They learned to talk about fear, desire, and expectations. 6 months later, he told me they're closer than ever.
Because the crisis forced them to stop pretending everything was fine and actually connect.
Exactly. He said something that stuck with me. I almost died trying to prove I was still young. Now I'm alive because I accepted I'm not.
That's wisdom, Michael. Acceptance doesn't mean giving up. It means adjusting your approach to match your reality.
And his wife stopped blaming herself once she understood the real problem wasn't what happened that night. It was the years of silence before.
So the lesson is this. Intimacy after 60 can be safe, fulfilling, and even healing, but only if you approach it with honesty, preparation, and respect for your body.
Get your heart checked. Manage your medications. Build cardiovascular fitness. And talk to your partner about fears and expectations.
Move daily. Eat well. Reduce stress. Stay connected to purpose. These aren't just good for intimacy. They're good for life.
So here's the bottom line. Is intimacy after 60 dangerous? Only if you ignore warning signs and pretend you're 30.
Is it necessary? For many people, yes. Connection, touch, and pleasure are fundamental human needs at every age.
But always consult your doctor, especially if you have heart disease, diabetes, or take multiple medications. This isn't medical advice. It's a conversation.
And if this resonates with you, share it with someone who needs to hear it. Silence is the real enemy here, not age.